Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The primary duty of the dental hygienist is the prevention of disease. Amalgam polishing alleviates the formation and retention of bacterial plaques on amalgam borders and margins, thus reducing the possibility of recurrent decay. A well-finished and polished restoration is easier to keep clean than an ill-finished and unpolished one. Amalgam polishing is also primary to the prevention of periodontal irritations. The tissue response to a poorly contoured and anatomically incorrect amalgam is similar to the tissue response to calculus. It's also important to view amalgam polishing with aesthetics. A polished amalgam is a sign of quality work, and the patient both appreciates and recognizes a polished amalgam as the sign of quality work. Before we begin in our amalgam polishing sequence, I would like to discuss just briefly the evidences of failure of amalgams that you can look for before you polish. Firstly, the fracture of an amalgam or the surrounding tissue, tooth tissue around that amalgam is a sign of amalgam failure. Secondly, any recurrent decay found around the margins of an amalgam is a sign of amalgam failure. Thirdly, any periodontal or pulpal involvement which is due to that amalgam restoration is a sign of that restoration's failure. It's important for you to be able to recognize these and to look for these in your examination. Before we begin the sequence, I'd like to show you some excellently done amalgams and things you may look for in a good amalgam restoration. On the first molar, this Class 5 amalgam restoration, you can see how smoothly and easily the explorer glides from tooth to restoration. This is a sign of virtually undetectable margin. This can be seen also on the occlusal of this restoration. The margins of a good amalgam restoration are virtually undetectable. Interproximally, there should be no amalgam overhang, and again, margins which correspond to the tooth surface. On the occlusal surface, you can see how the anatomy of the tooth is very closely duplicated. Now, these amalgams are not as smooth and polished as they normally would be because they haven't been polished. They were just recently placed. So you can't expect the amount of shine and smoothness that you do on a well-polished amalgam. But those are excellent amalgams, anatomically speaking. These amalgams, on the other hand, show evidences of failure. Firstly, if you note how the explorer jumps from tooth to amalgam, these margins are high. They are not flush with the tooth and therefore need polishing. Particularly important for you to remember in polishing an amalgam are these buccal and lingual areas, these buccal and lingual grooves, because these are very, very common areas for recurrent decay. Interproximally, it can be seen the amalgam does not adhere to the tooth. There is a slight overhang. You can probably see the explorer jump. And this overhang should be removed. Again, the tissue response to this overhang will be similar to that of calculus. And there is virtually little or no anatomy in the occlusal surface of these restorations. Here you see a variety of the instruments and materials that may be used in a polishing sequence. Now, you don't have to use all of these instruments every time, and there will be other instruments or materials that you may be introduced to in practice. We just wanted you to get an idea of the variety. Prior to polishing an amalgam, you should check it for any areas that are in contact. You'll need your articulating paper. Place the articulating paper between the teeth. Have your patient close in centric relation and use your articulating paper as you normally do. The areas that are marked red from the articulating paper are those that are in contact and should not be touched during the polishing of the amalgam. Here you can see this reddened mark on the mesial marginal ridge of the second molar. Also a small spot of contact in the mesial occlusal aspect of the first molar. Here you see the different types of burrs that you will use during your amalgam polishing sequence. The first burr to be used is used only on to remove gross amalgam, and it is a green stone. The second burr is a 242, or it's commonly called flame-shaped finishing burr. This burr is good to get into the small grooves, particularly the buccal or lingual grooves of the amalgam, and smooth them out. The next three burrs are your plug finishing burrs. We usually use them from the smallest to the largest. The smallest burr is good for working on the anatomy, particularly the occlusal anatomy of the amalgam. The second burr may also be used for working on the occlusal anatomy and some slightly broader surfaces. The third burr, which is, as you can see, much larger, is used on only broader areas of the amalgam. The final instrument is called a Mohr's mandrel, and we have a sandpaper disc attached to the Mohr's mandrel. This is used primarily in interproximal areas and often on class 5 amalgams also. And we'll be showing you the use of these burrs in just a minute. After checking with articulating paper to make sure of the contacts, you want to begin your polishing procedure. Now, the first thing you'll use, as I said before, was the green stone, and this is used to remove gross amalgam. Now, as you can see on these amalgams, there is not too much gross material, but for demonstration purposes, we'll show you how this works. Okay, you run your green stone, using, as you can see, primarily the tip of the instrument. Okay, and as I said before, this is used to remove only the gross amalgam. After the gross amalgam has been removed with the green stone, you may move to your 242 or flame-shaped burr. We will be polishing the particularly important buccal and lingual groove areas with this instrument. If you will recall, these are areas that are highly prone to recurrent decay if the margins are not well polished. It is important to check from time to time the areas that you are polishing, particularly the margins, to to make sure that they are becoming smooth. Now, if you will note in this particular area on the buckle, the area of the buckle groove, there is a large discrepancy between the enamel and the amalgam. This is a good example of an area that you could not polish down. In other words, there is a distance between the amalgam and the tooth. Here again, on the very distal buccal aspect of this amalgam, there's a very large discrepancy. And that's an area that you won't be able to polish down perfectly. In this case, we'd like you to get the amalgam, the margin of the amalgam as close as possible to the enamel. After you have used your 242 burr, you may go to your small burr, small finishing burr, the small plug finishing burr can be used to delineate the anatomy of the tooth. Remember that the anatomy of the amalgam should closely approximate the anatomy of the tooth. You'll also notice that I'm avoiding the area of contact that we had marked red. The red has been blown off, but it was right in that mesial marginal area. You may also use the small finishing burr to take down your margins. Once again, check your work with an explorer. Check your margins with an explorer. You can see the explorer is beginning to move more easily between the enamel and the amalgam. The margins are becoming much closer to the enamel. After you've gotten the anatomy that you want in the tooth, you may move to the next finishing burr, which is the medium-sized finishing burr. Now this burr will not delineate anatomy as well and is used along the slightly broader surfaces. You may also work along the margins with this burr. Again, any area that has marked red with articulating paper, stay away from it with your burrs. Once again, check the amalgam restoration with your explorer. I think it's probably really visible now how smoothly these margins are coming down. Now you move to the large burr, and as you recall, you can only do really the flatter, broader surfaces with this burr. You can also work along the margins with your large burr if you'd like to get them even more even. Once again, check the margins with your Explorer. Check the anatomy. We're now ready to begin the final polish. We're going to be using flour of pumice, and a rubber cup. You want a thin slurry of your pumice mixture, and by thin slurry we mean just a little bit less thick than a commercial toothpaste might be. Don't want it real watery. And you'll polish over your amalgam, again using the thin slurry, intermittent light pressure. After you've used your pumice, you want to take another cup for your tin oxide polish. Now it's really important to use another cup because you don't want to mix your pumice and your tin oxide. And you also want to make sure you get all the pumice off and rinse that very thoroughly. You don't want any of those large pumice particles to mix with the tin oxide. Once again, a thin slurry of the tin oxide. And that gives you your final fine polish. This completes the polishing of the occlusal portion of this amalgam. The first step in polishing a Class II amalgam is to remove any overhang of amalgam that may protrude into the proximal. Now you can easily see an amalgam overhang here on the mesial of this bicuspid tooth. Now on the distal of this tooth, the overhang is visible but not clearly so noticeable. And we move from the bite wing to a periapical of this same mandibular area. And you can see that it's hardly noticeable at all on this periapical film, that overhang. So in this particular instance, the bite wing shows up the overhang much better. We have just the reverse on this second molar, on the mesial of this second molar. We have an overhang that shows up fairly clearly in the periapical film. We move to the bite wing. Looks almost perfect. Here we have another visible overhang on a bite wing radiograph. From these films, it's easy to see that both periapical and bite wing films are of value in finding amalgam overhangs. This is a barred Parker, which we use for removal of amalgam overhangs. We have a number 12 blade, which is one-sided as opposed to a two-sided barred Parker blade. We've also placed a piece of adhesive around the center of the blade. This facilitates using only the tip. You may or may not want to do this, but I emphasize that only the tip of this blade should be used in removing overhangs. We're going to work on the mesial surface of this first molar using only the tip of the blade and working only supragingivally. I might add that not all amalgam overhangs can be completely removed or eliminated. But it's the job of the hygienist to get them as smooth as possible. After you've used your barred Parker, removed as much amalgam surface as you can with it, you want to move to an instrument which we call a rind trimmer. This is a double-ended rind trimmer. There are also single-ended rind trimmers. And the rind trimmer, much like a prophylaxis scaler, is a pull instrument. In other words, the working stroke is a pull stroke. And you can see how this instrument smooths and also removes amalgam. The working stroke, once again, is on the pull. Another instrument useful in removing amalgam overhangs is the Wheatelstat. And this is just the opposite of using a rind trimmer in that your working stroke is a push stroke. Let me demonstrate here. You can see that the working stroke is a push stroke, and you work parallel with the occlusal surface of the tooth. This instrument works much as a rind trimmer in removing and smoothing the amalgam. After you've removed as much of the overhang as you can, ideally the proximal surface of the amalgam should be flush with the enamel of the tooth. You want to smooth with the instrument that we talked about before, the Moore's mandrel. The Moore's mandrel is attached to the contrangle and used interproximally. Now, care must be taken to smooth only the buccal and lingual surfaces of the proximal restoration. Also take care not to injure the gingiva. With your mandrel. You can see how this might abrade the gingiva, so you have to be careful not to go too far cervically with this instrument. We can use a smaller mandrel to go a little closer cervically. It's always a good idea to flex the discs so that they aren't too stiff, again, to prevent abrading of the gingiva. And you can see with this much smaller disc that you can get closer to the cervical area of the proximal surface. Of course, you should be reevaluating your margins with your Explorer, and once again, they should be flush with the enamel, as you can see this one is. Your final polish, just as we polished on the occlusal surface of this restoration, should be with pumice and tin oxide. Prior to your final polish, you should smooth the cervical proximals with some finishing strips. And you can see here the difference in a finishing strip. The squared off or flat end is the way it comes, and I've pointed it for easy access into the proximal. And you want to thread that. Through the proximal and work it just as you would dental tape. This is much more abrasive, as you know, than dental tape, so you want to be very careful not to abrade the cervical gingiva. Work it very carefully, and you can come out through the occlusal edges. Then you would go ahead, use your pumice and your tin oxide, and your final step would be, just as if you were polishing during a prophylaxis, to use the dental tape. I'd like just briefly to contrast the use of the rubber cup with the soft bristle brush in amalgam polishing. The soft bristle brush is recommended, but has to be used judiciously, as cervical abrasions of both the tissue and the cementum may occur. The rubber cup, while it's more easily adapted, can cause an easier heat production. If the rubber cup is more convenient to use in your prophylaxis procedure, go ahead. The one thing to always remember, of course, is to use separate rubber cups and bristle brushes for the use of your pumice and tin oxide in the polishing procedure. The first step in polishing a Class 5 amalgam restoration would be to check the margins, just as you have in other classifications. Here again you can see the Explorer jump. There is a discrepancy between the amalgam and the restoration. Now you can note that this restoration extends almost to the cemental surface, so we're going to have to be very, very careful in our use of abrasive instruments. The tip of the greenstone may again be used here to reduce gross amalgam. You have to be very, very careful to use only the tip, particularly when you get near the cemental surfaces. There's not too much gross amalgam here. This will do for demonstration purposes. You may want to use the 242 or flame-shaped burr here. Again, being very careful to adapt it. This particular burr, you can run along the amalgam restoration. And of course you have to be very careful that the tip does not abrade the gingival tissue. Now you can move either from the greenstone to your disc again, your waterproof disc, or to the 242, which we just saw, depending on the amalgam and the amount of reduction you have to do. Here we have another waterproof disc, and remember to flex the disc somewhat to prevent gingival abrasion. These tend to be just a little bit stiff. Very, very carefully. And I can't emphasize strongly enough the care you must take to not abrade the gingival tissue. And we can go again to the smaller disc. You might find it more advantageous to use this a little more closely cervically. These discs will smooth and contour, but you must use a light touch. It's a good idea to keep checking visually and with your Explorer the buccal contour of this amalgam. There are still some areas where the margins should be taken down. And if you can see right here on the buccal-distal aspect of this amalgam, there is a large discrepancy. You can see my Explorer stick in it. We're beginning to have some recurrent decay here. This is an area where you will not be able to get the enamel flush with the amalgam, or rather the amalgam flush with the enamel. Once again, you'll recognize that there are areas where you cannot take the amalgam down to be perfectly smooth with the enamel. I'm going to go over the margin with my 242. Once again, make sure you keep constantly checking the buccal contour and the margins of your amalgam. There, we've got it very smooth. Now, in a Class 5 amalgam restoration, it should be obvious that you rubber cup polish and never use the soft cup brushes because of the possibility of cervical abrasion. Here I'm using, as you can see, a webless cup, and this adapts very well cervically. Just demonstrate it here. But cup preference will be up to you to make the decision. And then, of course, you would go ahead and polish with the pumice and the tin oxide, just as we did in the other two amalgam restorations. Polishing agents other than pumice may be used for your primary polish. For example, silex or zirconium silicate. Tin oxide should be the final polishing abrasive that you use in your amalgam polishing procedure. In summary, remember the following important precautions. First, to prevent under-contouring, use a thin slurry of abrasive. By thin slurry, once again, we do not mean watery. A watery abrasive will be ineffective. Use a toothpaste-like consistency or slightly thinner than a toothpaste-like consistency of abrasive. Secondly, to minimize heat production, use a low speed or a speed slightly higher than that of a routine prophylaxis polishing with a rubber cup, and use a light intermittent pressure at all times. Finally, eliminate premature polishing by waiting at least 24 hours between the insertion of the amalgam and the polishing procedure. In this manner, you will not disturb the structure of the hardening amalgam.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.